or acute necrotizing ulcerative gingivitis. Okay, so this topic again is a short note as well as a short essay for you guys. It can come as a short note also, it can come as a short essay also. Okay, so coming to the definition of Anug. What is Anug? Okay, Anug is a microbial disease of gingiva in the context of an impaired response, impaired host response. So there is an impaired host response is there. So because of that, there will be an increase in the microbial load. Okay, so this will be characterized by death and sloughening of gingival tissue. The tissue will get necrotized, tissue will get sloughened. Okay, mainly it will affect only the gingiva. Okay, and characteristic signs and symptoms. So I'll once again put the definition all together. The microbial disease of gingiva in the context of an impaired host response characterized by death and suffering of the gingival tissue, present with characteristic signs and symptoms. This is the definition of Anug, or acute necrotizing ulcerative gingivitis. So there will be a severe necrosis of the free gingival margins. So this is the free gingival margin what we explained last class. So here will be necrosis. You can see the second figure. There will be necrosis in the free gingival margin, the crest of the gingiva and interdental papilla. This is the crest of the gingiva. This is the interdental papilla. So there will be severe necrosis will be there. So that's why it's called as acute necrotizing. Acute means very fast, fastly spreading. Okay. So it's other name of Anug is trench mouth, because the prevalence is more in soldiers working in the trenches during the First World War. Otherwise, it's called as Vincent's disease or fusospirochetal gingivitis. So these are all the other names of Anug. So, clinical features. What are all the clinical features you can see? Okay. In general, there will be history of repeated remission and exacerbation of the lesion. Okay. I mean, reoccurs in previously treated patients, because this lesion will again reoccur when you have done the previous treatment also. Then, in site, mainly it is seen in the gingiva, can be seen as a single tooth or in a group of tooth, or it's a widespread. Widespread means the entire upper, lower arch, full arch can be involved, or sometimes only the single tooth is involved, or a group of tooth is involved. The previous slide what I've showed, it's a group of tooth. You can see this much of group of tooth is involved. You can see here molars are all intact. Only this much of group of tooth is involved. Okay. Now coming to the tissue destruction. Okay, it's a long-standing disease mainly seen in the immunosuppressed patients. Okay, when the immunity of the body is reduced in such cases or such patients, because of some disease, your immune system will be suppressed. Okay, so in such cases, the prevalence of the disease is more. If it is only pertaining to the gingiva and there is no bone loss, it is called as acute necrotizing gingivitis. Okay, if there is a bone loss occurs, then the term changes as necrotizing ulcerative gingivitis. Okay, now coming to the oral signs and symptoms. Oral signs and symptoms, first, as you guys all know, it's punched out ulcers will be there, or punched out margins will be there. You can see here, there's a punched out margin, crater-like depression. This is a crater-like depression, the punched out margin, crater-like depression at the crest of the interdental papilla. They extend up to the marginal gingiva. Then, surface of the craters is covered by a gray pseudomembrane or a necrotic tissue or debris. You can see here, no, gray pseudomembrane is covered here. Or either it can be a necrotic tissue also. Okay. So one main feature of acute necrotizing ulcerative gingivitis is nothing but a pseudomembrane will be present. Okay, a pseudomembrane or plus the necrotic tissue debris will be there. Mainly seen in the age between 15 to 35 years. Okay, will be pain, because of the the condition. There will be pain. There will be interdental ulcerations will be there. Gingival bleeding will be there. These three are the diagnostic triad. These three are the diagnostic triad for acute necrotizing ulcerative gingivitis. Okay. Now coming to the interdental papillae. The interdental papillae As it is in gingivitis, there will be inflammation. There will be inflammation will be there. There will be edema or edematous it will be, and hemorrhage. Okay. So once you touch the papilla, there will be profuse bleeding from the papilla will be present. Then spontaneous gingival hemorrhage, I just now told. Spontaneous gingival hemorrhage after the slight stimulation, fetid odor, and increased salivation progressively destroy the gingiva and periodontal tissues. Now, it's a constant radiating groaning pain intensified by eating spicy or hot food and chewing. Because whenever the patient having an hot food or a spicy food, what happens is there will be constant groaning pain will be there. There will be metallic taste of saliva. There will be metallic taste. Extremely sensitive to touch. Once you touch the tooth, once you touch the gingiva, there will be severe pain. Excessive amount of pasty saliva. Ideally the saliva is not pasty. Okay, so what happens? There will be a pasty saliva will be there. The thick mucus type of saliva will be present. Now coming to the systemic signs. Systemic signs, as we all know, if there is a disease that is going or a patient is having a disease, what happens? The first sign will be a regional lymphadenopathy will be there. And obviously, there will be a slight elevation of the temperature. There might be severe fever might be there. Leukocytosis will be there. Gastric disturbances will be there. Tachycardia, loss of appetite. These are all the symptoms will be more seen in children. The severity of these symptoms more in children. Now coming to the stages of progression of Anug, or you can say that stages of Anug. Okay, so first the lesion starts as an erosion at the tip of the internal papilla. So first there will be a small erosion at the tip of the internal papilla. Internal papilla, there will be small redness and small erosions will be seen in the first stage. Then slowly the lesion involves the entire papilla and slowly in the marginal gingiva also. Entire marginal gingiva will be involved. Once the marginal gingiva is involved, slowly exposure of the bone, with complete loss of internal papilla, marginal gingiva and attached gingiva. So this is how your progression of an acute necrotizing gingivitis happens. Slowly, first from the internal tip of the papilla, then entire papilla, then the marginal gingiva, and then the bone, and entire attached gingiva, and all those things. So, coming to the stages, again, in stages of Anug, you can say that necrosis of the internal papilla, necrosis of the entire papilla. Stage 3 is necrosis extending into the gingival margin. And stage 4 is necrosis extending into the gingival attached gingiva. So these stages of Anug should be there in your answers. When Anug is asked, okay, the stages of Anug, how it is spread, you have to write it in your answer. Extending into the buccal or labial mucosa, necrosis exposing the alveolar bone, necrosis perforating the skin and the cheek. That is nothing but your norma. Okay, so these are all the stages of Anug. When you imagine that you are getting a 3-mark question, once you write the stages itself, entire clinical features, the part of the clinical features are done. Okay. Now coming to the treatment objectives. So your first treatment objective is the alleviation of acute inflammation, because there is severe inflammation is there, severe bacterial load is there. So first aim is to alleviate the acute inflammation by reducing the bacterial load and removal of the necrotic tissue. Okay. The second aim is alleviate the general symptoms, fever, malaise, and all those things. Okay, your GI disturbances and pain and all those things. The second part. The third is reduction of systemic conditions that contributes to the initiation or progression of the gingival change. Because there will be some systemic condition will be there. That systemic condition, along with that, you have got Anug. So that also should be corrected, or that also should be treated. So coming to the first visit, first is the goal for reducing the bacterial load and the necrotic tissue. So complete evaluation of patient should be done. Okay. Treatment of acute lesions is the primary goal. So once you do, or what you can do is you can slowly apply the local anesthetic application should be done. Then after 2 to 3 minutes, gently the gingival tissue is rubbed or swabbed remove the pseudomembrane and non-attached surface of the debris. When you remove it, the cotton, entire pseudomembrane and the non-attached surface debris will be removed. Clean it with warm water. Okay. Ultrasonic scaling may be preferable because rather than doing hand scaling, ultrasonic scaling will be preferable with minimal pressure against the soft tissue. You cannot use severe pressure to the soft tissue because again you are damaging these soft tissues. Gingival scaling and curettage. Okay, and, this may extend the infection to a deeper tissues and cause bacteremia. So don't do subgingival and curettage below certain point. Then start with the antibiotic regimen, that is amoxicillin 250 milligrams Xali for 10 days, erythromycin 200 milligrams Xali, and metronidazole 200 milligrams thrice daily for 7 days. Now, what are the patient instructions you are supposed to do? Okay, patient instructions is first, the patient drinks 3% hydrogen peroxide because the hydrogen peroxide has an ability to remove the pseudomembrane, and warm water every 2 hours and twice daily with 0.12% chlorhexidine solution. Chlorhexidine solution, again, it is a chlorhexidine solution is again a antibacterial properties the chlorhexidine, so that can also help you. Then get adequate rest. You are supposed to take adequate rest. Avoid excessive physical exertions. Confine toothbrushing to the removal of surface debris with and device, and then you are supposed to use an ultra soft brush, and the brushing should be very soft so that you are not supposed to provoke the bleeding. Then analgesics such as NSAIDs, ibuprofen, and all those things can be given when you want to reduce the pain. In the second visit, after 2 days, first visit, patient is evaluated for resolution of the signs and symptoms, whether all the signs and symptoms which previously was seen is reduced or not. You have to see. If the lesion, you have to check for the lesion. The lesion will be erythematous without a superficial pseudomembrane because they are using this hydrogen peroxide and chlorhexidine rinse. Pseudomembrane will be removed. Shrinkage of the gingiva may expose previously covered calculus because since till now the gingiva was inflamed. So once the when the gingival inflammation reduces, automatically the calculus that is present below the inflammation can be seen. So gently remove that. Okay. Instructions as instructed previously. Instructions are again. The third visit should be after 5 days after the second visit. Okay. So patient is again re-evaluated for the resolution of the symptoms, and a comprehensive plan for management of patient's periodontal condition is formulated. Okay. Hydrogen peroxide rinse is discontinued. In the third visit, if you can find the change in the gingival status, you can reduce you can stop the hydrogen peroxide rinse. And chlorhexidine rinse can be continued for 2 to 3 weeks. Supportive treatments such as rest, appropriate fluid intake, and soft, nutritious diet should be followed. Repeat scaling and root planing if required. You don't need to just do it. Okay. Instruct for plaque control measures. Again, toothbrushing should be proper. In the patient counseling, okay, that part is not required. Nutrition and smoking doesn't come for the pediatric children. Appointments should be scheduled. The treatment plan for chronic gingivitis, periodontal pockets if present. If there is a periodontal flap is required, you can go for that, and if there is any local irritants, it can be removed. And after that, the patient is again re-evaluated after 1 month. Check whether there is no signs and symptoms of Anug. This is the entire. I've spoken about the entire part of Anug, acute necrosis gingivitis. This is the outline you need to follow when you are writing an exam and when you are writing for the exams. Like, what is the definition? What is it? What are the different names? What are the general features? What are the oral features? And how do you manage? What are the zones? And then how do you manage? Okay. that is about your gingival diseases in the children. Okay.